So look, tonight's call. So tonight we're talking about trauma transference. And specifically we're talking about trauma transference in birth workers. But before we jump into that conversation, I want to lay the foundation of what birth trauma really looks like. And then we're going to kind of unpack it with the other doulas and stuff like that. So all right, so birth trauma is a belief that mother or baby, it's mother's belief that either she or baby are in danger of injury or death. And or I would say, or it could be feelings of helplessness, hopelessness, a lack of control over her situation. And this can occur anytime during labor and delivery. So birth trauma does not have to be, listen to me now, birth trauma does not have to be justified by the provider. Like the provider does not have to agree that there was a traumatic experience. Like if mom feels that way, it is her experience. And so it's really important for us to acknowledge that this is something that's going on. Okay, so statistically, if you guys are looking for statistics, about 25 to 34% of women report a traumatic birth experience. And that's, you know, regardless of what is actually happening, but it's her own experience, like how she is interacting with her birth experience. Now, trauma, what's the word? Okay, so here's the challenge with birth trauma is that it can be compounding. So, you know, like whenever I'm talking about birth, I'm always talking about like birth is a physical, mental, emotional, and a spiritual event. So we can go through several different layers of trauma during birth, but then even understanding you can walk into the birth room already traumatized. Right, already traumatized, and now this is compounding on your own experiences. And so these are things that are really important to acknowledge, but then also recognizing the effects that play on the partner. So if mom experiences a traumatic birth events, then recognizing that there is a partner there with them. Now they are both walking away looking at birth from a different lens, right? And so this has a negative effect on their relationship and on their postpartum time. And so this is part of the cycle that is affecting our communities, right? And so when we think of birth trauma, we have to recognize everyone in the room. And one last thing I'm going to acknowledge is that what trauma can look like. So trauma can look like miscarriages. It can look like C-sections that are, you know, like C-sections that come on the words of a provider that is just pushing it, right? So those negative words like, oh, if we don't do this procedure, whether it's a C-section or not, if we don't do this procedure, you or baby can die. Those are traumatic words, and that will always put mom in a fight or flight stance, right? The use of forceps or any kind of forceps. What's the other ones, lady? It's
vacuum.
Yeah, forceps, vacuums, episiotomies. All those are traumatic experiences.
Insertion of their hands.
Insertion of their hands. Come on, let's talk
that.
Mm-hmm. And then the last one is repeated trauma. So if this is not the first baby, but this is the second time mom is birthing or the third time mom is birthing, and she has all these negative experiences that are now compounding. Oftentimes, like my clients, oftentimes when I have a client, it is a repeat mom. Like mom already has a baby, and now she's like, I need to make amends for that first experience because that was a very difficult one. And so when we talk about as we shift the conversation into like the support person, right, recognizing that if the support person comes out traumatized, it is for one or two reasons. Because everybody in that doggone room walked away traumatized, or because the doula held the brunt of the trauma themselves. Okay, so I'm gonna let that sit. And so now I'm going to ask the other ladies to step in. So Nicole, how has your experience been with birth trauma, whether yours or your clients?
So I think I've experienced my own form of birth trauma. Probably something that I haven't dealt with the way that I, you know what I mean? Like I processed it a lot later, not realizing in that moment it was trauma. Um, I had like an emergency C-section that should have never happened. So going from literally walking in a hospital at 3 centimeters and having a C-section 5-ish hours later because I was, failing to progress. And probably, just recently, having looked over like the birth notes in like detail, now seeing like, what should and should not have happened to me. So processing it probably just maybe about a year ago, or starting to process it at that point. From the doula perspective, I think, I think what you said about us holding space and therefore like taking on like a lot of the trauma that may go into the room, or even what parents may not perceive as trauma, they may walk away and feel like their birth was beautiful. We see that a lot, and where we walk away feeling like maybe not so much. And I think it's because we form this intimate connection with our clients. We're there and we know what should and should not be happening at birth. And so taking a lot of that on, and, even it coming down to something as simple as like a doctor dismissing something that you say, or a doctor not asking for consent to touch you or to check you, nurses coming in and things like that. And it's not even just doulas, because nurses experience
Yes.
birth trauma, like the transference. And it's when we talk about birth trauma from our point of view, from the birth worker point of view, it's a secondary trauma. So it's a secondary trauma, stress or disorder that we're ultimately feeling, that can then lead further on down to like PTSD and things like that. But taking on, because it didn't like actively happen to us, but we witnessed it, and therefore something that we now have to process on the back end of things. So, and also I would say the inability to be able to act on it all the time, because we can't go in for our clients and actually write up a report of abuse. That's something that they have had to have felt and have decided to act on. So sometimes it's just something that we walk away with and then have to go and debrief with other people in the birth world to be able to even understand and process it, or our own counselors as well. So
Absolutely. So I'm going to touch on one thing you said in regards to like who experienced the trauma. You mentioned nurses. One of the things I really believe is I really believe that there's a lot of people who are walking around who have experienced traumatic births, but because they have assumed it to be normal, that they're just passing on this trauma. And so
right.
like trauma transference is not just like, oh, this crazy thing happened, but this is the crazy thing that was told to me about birth. And so now I'm giving it over to someone else so that they could hold it as their own,
Right.
And then just recognizing like how many people are not well versed in natural birthing, one, and then two, like how many people are not seeking healing, you know what I mean? Like healing the way they should from their birth experience, or even like from talking to somebody about their birth experience, like just
Right.
recognizing that, like it's so many different shades. Okay, Eb, I know you have a very unique experience because you are not only a doula out in sunny California, but you are a nurse. And so like recognizing that like you actually hold both hats. So talk to me about your experience.
Shall we? So before I go into like my experience, I want to touch on a couple of things that Jen said and that you said, Nicole. One thing that Jen talked about when she was discussing the actual, what birth trauma actually is, what it looks like. 3 things that she said that I literally experienced. She said helplessness, hopelessness, and a lack of control. If you guys are on the previous Dinner with the Doulas, I did go through the story of when I was with my niece and she almost suffered a cardiac arrest. It was from a high dose of magnesium, and I had been speaking with them for hours, trying to get them to check her, assess her, call the doctor, draw blood. They wouldn't do any of the things. They didn't believe I was a nurse. I kind of had to pull the whole nurse card and just go through the nurse jargon and like, if I don't get somebody in here now, like, it's going to be a problem. I had to like threaten for patient relations. So because of that, like I felt all those emotions, I felt helpless. And when I did her assessment myself and she wasn't responding, then I felt hopeless. And even though I was a nurse, I wasn't a nurse there. So I also felt like I had a lack of control. I couldn't even get them to call the doctor. You get what I'm saying? So those were a lot of emotions in one. And so it's important for people to understand why you need to be informed, why you need information, why you need knowledge, because the system is not built to protect you. The system is only going to tell you what they want you to know, because when you know too much, you can kind of control what's going on versus allowing them to have full control. But you have a plan, they have a plan. And their plan is literally like they just have like a standard operating protocol and they just want to do it for everybody. But what we know about birth is that every birth is different. Even if one person has 10 babies, every last birth is different. So standard protocol is just ridiculous. And also birth is uncontrollable and it's unpredictable. It's a natural phenomenon that we try to control.
Yeah.
And so it's important to also understand that your provider, like Jen said earlier, does not have to agree that it's birth trauma for it to be birth trauma. And I think what we also have to understand and realize and stand in our power to know, I don't care if it is a provider, a doctor, a nurse, a midwife, whatever they might be, they do not know more about your body than you know. They have no natural instincts. They're not feeling the what you're feeling. They're not feeling that intuition. They don't have that moment of anxiety. They don't have that thing telling them this doesn't feel right, because it's not them. Okay. And also remember, we are in a society to where like 3% of our doctors are minorities, right? And then let's go down to the specialties. So there's nothing that a white male doctor can tell me about my body as a Black woman, or if you are a woman of mixed race, or if you're a Latino, or if you're a woman who's an Indian, like understanding that you have these lived experiences that they don't understand. And male doctors don't even have a uterus, for crying out loud. So like here we are in this society that they're the ones treating us and controlling this. So that's another thing. And one thing Jen talked about is when you're dealing with breast trauma, that can carry over to your postpartum and you can have a negative postpartum experience. There are a lot of women who have babies and they suffer such inhumane breast trauma, they can't even connect with their babies. They can't even connect with their partners. So think about the trauma that causes. Like, I can't connect with my baby. You're already in postpartum. That's more depression. I can't connect with my partner. There's a lot, breast trauma, there's a lot that can happen. And people forget, like, just because you make it out with your baby, you know, it doesn't mean that you didn't leave without some type of trauma. And providers love to use manipulation with words and language. You said that earlier. You don't want your baby, if you don't do this, your baby may die. You don't want your baby to die, do you? That's what they love to end with. We probably should do this because you don't want your baby to die, do you? Well, the baby's not doing well. They just focus on the baby, the baby, the baby, the baby. Why? Because they know if they focus on baby not making it, baby dying, baby not doing well, you've been carrying this baby for almost 10 months. That's the last thing in the world that you ever want. And they know that. So that's what they're going to go towards to get you to make the decision that they want you to make. And so the use of intervention is traumatic. You have women who are getting episiotomies who don't need episiotomies. And so think about episiotomy as this. So, you know, at Christmas when we're wrapping gifts, right? And you have that amazing pair of scissors and you just start to cut. And all you have to do is just do one slice and it just continues to split. That can happen with an episiotomy. You can your incision can be too much of an incision, it can be too long. Understanding that when you allow your body to naturally tear, I don't like to say rip, they like to say rip because it sounds bad. Your body is only going to tear how much it needs to tear to allow for baby to come through. And that usually often happens when moms aren't allowed to get up, to move around and those things, when you're laying on your back in a bed, you know. So, and the support person trauma that you spoke on, that's huge. I was a support person and going through the experience with my niece. Still today, I do not feel comfortable giving birth in the hospital because I know too much as a nurse. I know what's going on in the background. And I also understand that when you're in such a vulnerable position, it's hard to fight. And by fight, I mean it's hard to like speak up for yourself, stand up for yourself, go against all of the things. Like, it's like the powers that be. You walked into there and it's like, okay, here we go. It's like you gotta suit up and be prepared for war. So
Absolutely.
and these are some of the words that they may use, guys. And this is where the fear comes from. So they're gonna start using these words at your visits, not even in the labor room. You start using them at the doctor visits, because by the time I get you to the labor room, I've said it so much, you're scared at this point. You're one thing that we talked about in labor, you're failing to progress. Nicole had just said it. I went in there at 3 centimeters, and then 5 hours later, you want to do a cesarean. You haven't even given me a chance to progress. I'm not failing to do anything. You just haven't given my body a chance to even try.
And I think
go ahead.
That's huge. So okay, so I'm gonna jump in and then let you get back to what you were saying. So I think what is so important in this space is that women understand what their body is capable of doing. Like, that's why, like, as a doula, like, I hone in on education, because if you understand what your body is capable, then whenever someone whenever someone says the opposite, then you could raise the standard, like, no, this is what I know. And then on top of that, recognizing that, like, if you've heard the language before, you know what I mean? Like, as a doula, I frequent the birth room, so I hear all the stories and stuff like that. And so, like, if you hear this is where they're going, you know what I mean? Like, it's almost like chess, like being able to recognize the moves that each player can make and stuff like that, and then being able to counter it. And it's unfortunate that on the day of childbirth that we would have to, like, be strategic about the language we use versus the language we allow them to use on us. And at the same time, if not, like, trauma is waiting on the other side of the door. So you were making a point, Ebony, about language, about the language that they use in the birth room.
And so the failing to progress, like we were talking about the birth room, but these are the things they're going to start to tell you in the doctor visits. Oh yeah, it looks like your baby's too big. The later part of your pregnancy, your baby's too big. Oh, your pelvis is too small.
Or too small.
Yes.
Yeah, your pelvis is too small. You're a first-time mom, so you know what? This labor is going to be really long. You're like 2 weeks past your due date. What do we know about due dates? They can be 2 to 4 weeks outside of the actual time. Like, let's just go by a due month. You're too old. This is a geriatric pregnancy. You're high risk. We're going to have to do a cesarean. So, like, the words are, it's so much pressure from your provider. So if you're having a hospital birth, I'm going to tell you right now, your provider can make or break your birth experience, because you want someone who is supportive of whatever it is that you want to happen. And understanding, guys, you were created for a purpose and to do what it is that your body was made to do. If you weren't created to have a baby, you will not have a uterus. Now, we can all get pregnant naturally. We don't all have children. But what I am saying is that if that's your path in life, it's going to be made available to you and you can do it. But the system does not work in helping you believe in yourself that you can make it happen. The system helps by making you think that you need them. I'm going to mentally condition you to believe that you need me, so you come here so I can do what I want to do to you, which is most often not treat you the way that you should be treated and not take care of you properly. And the last point I want to make is, even when it comes to C-sections are treated as if they're just this simple procedure. A C-section is a major abdominal surgery. If you come into the hospital and you get a major abdominal surgery, you're going to stay there for at least a week. And I'm going to take care of you for at least a week. With a C-section, they're going to discharge you in 48 hours.
48 hours.
Or less.
Or less.
Or less.
So,
I just had a client sit home at 24 hours, which was outrageous.
That is insane.
And guess what? She was back at the hospital the next day.
So let me jump in and explain why that's insane, right? Because from, like, I think sometimes, like, we can be, oh, C-section, yeah, they need to be in the hospital, but let me explain why that's insane. So the incision is done, like, at the lowest part of the abdomen in order to enter into the uterus properly. When it's done, it cuts through like all those major muscle groups to get to baby. And then very quickly, you know, they get in, they get baby out, they get the placenta out, they close everything up very carefully, and then they close out the exterior. So there's two sets of stitches in there. Correct me, Nurse Ed, when I go wrong. And so there's two sets of stitches inside to close the uterus and outside to close the abdomen. But you have to understand where your center of gravity is. You know what I mean? Like, your center of gravity is right there in the middle of your body, and they're cutting through major ligaments, right? And so when we cut through those major ligaments and stuff like that, it is so wildly important that we allow that space to heal. Any other place on the body, we would allow it to rest. I break my arm, I put it in a cast, I leave it still. You know what I mean? Like, I break my leg. Look, I fractured my leg, you know what I mean? And tore ligaments in my ankle, and I allowed it to heal. Like, literally, I sat in bed with that thing elevated for at least a week, you know what I mean? Like, and I was barely using it like a month later, you know what I mean? Like, I was really giving it time to heal. Now, when you send a mom home with a baby, with a new baby, and then you tell her, don't pick up anything more than 10 pounds, look, them babies be more than 10 pounds, like 1 week past, you know, like, and so we're not giving mom's body the time to rest. And then if you consider like, oh, I got to take baby to a doctor's appointment. So check mom walking out the house, baby in hand. So we'll put this a teeny tiny baby. We're going to put it 6 pounds, 6-pound baby. I'm not supposed to lift anything over 10 pounds, 6-pound baby. I got a 4-pound diaper bag. Okay. Not even the diaper bag. Say mom is using a fanny pack to carry her stuff. You know what I mean? Like, so 6-pound baby, 2-pound fanny pack, and then she got a car seat. You know what I mean? Like,
okay.
like we go over 10 pounds instantly. You know what I mean? And then you have to consider like how many moms actually have people like people to go with them to their doctor's appointment. Oh, it's COVID. Can't nobody come in but mom anyway. Okay. Can't nobody come in but mom anyway. Oh, okay. So what mom's gonna do is she's gonna get the stroller. Okay. So the stroller isn't gonna help, except for they're gonna take all that carriage and they're gonna put it on, put it on the stroller. So the baby goes in the stroller, this goes in the stroller, the diaper bag, this, that. But then all of it has to get into the car, and she's using her center of gravity to do all of that, and I can appreciate medical advancements, because I know people who will say beyond a shadow of a doubt that C-section saved my life. And I can absolutely value and appreciate that. And at the same time, for those moms who know beyond a shadow of a doubt, I did not need that C-section. I did not need that repeat C-section. I did not need that repeat C-section. That it is offensive to say to a woman's body, you are inadequate. And I am the answer. Ed mentioned it earlier and stuff like that. It's a savior complex that says your body can't work without me. Yes. And so you need me at any point. Like, I'm the doula, man. I'm the hype man. Look, you got something for me. Look, tell me you're not feeling good in some way. I'm gonna hype you up. And at the same time, at any point, at any time, I'm gonna be like, hey, I'm gonna need you to stand up in this. You know what I mean? Like, at any time, because like, it has to be mom's will. It has to be mom's knowing. It has to be mom's intuition that says, hey, Jen, I know you almost at my house, but I need you to call I need you to call the ambulance now, because I have a knowing. Yes, Jen, I know we were supposed to labor at home, but I'm halfway to the hospital. I need you to meet me there. I have a knowing. There is something to a mother's intuition that simply just says, I understand that you have the education, but I have the experience in this body, and I know what I know. Whether I can or I can't, both are true, but it has to be mom who's making that decision. It can't be a decision that's made for mom. So I'm gonna be quiet now, and I'm gonna ask Nicole a question. I'm gonna say,
y'all have said so much. I'm over here just taking notes, but now I can't go all the way back to what Ebony said and all, like ask the question.
Oh, yeah, okay.
Because I can't go back.
So, Nicole, I want you to explain brains. Like it's an acronym we use in the doula world. There's some providers. Do you have that acronym like handy? Because I
Oh, yeah.
always forget. Okay.
Oh, I don't have it handy, but
Okay.
I know it.
But
So,
can you break
yeah,
it down
yeah.
for like and I think this is I think this is a good I think this is a good segue into like how to help people prevent trauma, you know what I mean?
Mhm.
And then I want to get into some traumatic experiences that we've experienced as the doula and not as the birthing. Go ahead, Eb.
And Nicole, before you go into, because I know she's going to go into like, the prevention and like she's going into the brain acronym. But for the people who are wondering, like, is this real? Is this happening? Like that savior complex. I want to tell you, I had a consultation just recently, Saturday, and she told the provider that she was looking for a doula, that she's going to have a doula. And he said, for what? You don't need a doula. I'm all that you need. Doulas cause conflict. So
That's a trigger. That's a big
red
old
flag.
Red flag.
Red flag. Yeah.
Red flag.
If a provider is not interested in you having a doula, or they are not interested in hearing your birth plan, I've had providers tell me, like, me carrying big old baby, and they're telling me like, oh, you got a birth plan? Yeah, that's right out the window, because people with a birth plan always wind up with a C-section. And I was like, I looked at them and I was like, that's funny, because I'm a doula and I help a lot of people write birth plans for a reason.
As you are, and that's a red flag that he doesn't want to work with someone who's a part of your birth team, who's there to be supportive. Doulas don't cause conflict. What doulas do is they provide wealth of information, knowledge, and resources, which makes it tough for them to have their own plan and to do what they want and to be questioned and to explain things. Because with the savior complex, it says, I don't have to explain to you. You should just listen to me and do what I say do. So understanding that you should be allowed to have whomever and whatever be a part of your birth plan, as long as it's going to be safe for you. And that was
agreed.
Absolutely.
And I think, that's the thing, even when you talk about, we'll just say like, even like vaginal birth after C-section, they always say like, make sure you're going to have a VBAC friendly doctor, but you need to do the same thing when it just comes to birth. You don't want somebody who's just tolerant of your birth. You want somebody who actually believes in you and supports you, even as your provider. Forget the inner circle, forget your doula and all of that stuff. But you need your provider to believe that you can birth the way that you want to birth. And so if you somehow, encounter, or you're sitting down with somebody and they're speaking opposite than, what it is that you want to do, then you need to, walk away, get away, run away. So, and when we talk about, and now I do have to go back, Ebony, I don't know if it was Ebony or Jim. I think both of you sort of said it, but like, listening to your doula, because things that we've seen along the way, and then when they pop up, we know the red flags already. And I think it's, we three of us have this conversation often. We have a client, we see the red flags. We're trying to tell the client, like, this is what your doctor's saying. Like, we already see it. It's laid out. You know what I mean? And the clients tend to be like, oh, well, no, because the doctor said, or the doctor did. And it's like, but why did you hire the doula? Like, what did you get your doula for? And, we're on your side, not to say your doctor is not, but doctors think first liability. And second, they're thinking about my vacation in Hawaii that's coming up this weekend. So let me hurry up and figure out how I can get you off of this, So I think, listen to your doula. Yeah. And pay attention to what's happening, because there's a reason that we're doulas, and there's a reason that you hired us to support you in this birth. And even if you don't agree with what we're saying, at least take what it is and look at the resources and pay attention, because our goal is the same thing as your goal, which is for you to walk out of there having the birth that you wanted to have and the baby that's going to be in your hands or you're on your arms. So I think that's huge. And I think the language that is used just in birth in general, anything that's negative in birth is almost like you're blaming the mom. Failure to progress. Well, who was failing to progress? The mom. You know what I mean? Or incompetent service. Incompetent service. Like,
here we go.
How do you create a competent cervix? Is that something that I go out and buy? Or was I supposed to prep my cervix in advance of having this baby? What's going on? Geriatric pregnancy. So because I'm over the age of 35, now
I'm geriatric.
I'm a grandma. Right.
And
So
I think,
all of these things are sort of stacked up against us before we even have a baby, before the first
yeah.
contraction hits, we already experience all this stuff. So then I'm taking all of that and sort of leading into the brain segment. So you asked about brain, Jen.
Yeah.
And when we talk about brain, really what brain is, it's an acronym that we use in the birth world. I think you should just use it across the board, just in life. Forget birth and everything else. Apply it to life. Apply it to when you go to regular doctor's appointments. Apply it to your job. Apply it definitely to your birth. But brain basically, it stems from having informed consent. And so when we talk about informed consent, that is before you do anything to me or to my baby or to my body, that you have the consent and you have to make sure that I agree to it. And part of that agreeing is asking yourself some questions. And so those questions are what we look at when we look at brain. And before we look at brain, the first thing we ask, let's just say a doctor comes in, you're in labor, and they're saying, you're failing to progress. Let's go ahead and give you some Pitocin. And so the first question to ask is this an emergency? So that's the first thing. Before we even get to the brain, is it an emergency? No, it's not an emergency. So what's next? B. B is what's the benefit? So what's the benefit of this Pitocin? Do I need it? What is it going to do for me? What is it going to do for baby? R, what is the risk? What's the risk behind me now inducing my labor? Is there some sort of reason that we're having a medical intervention? And what harm could it be doing us? What is an alternative? That's the A, alternative. So, what else can I do? Rather than you hook me up to this IV and pump some sort of artificial, oxytocin into me that creates these contractions. Can I be doing something else? Maybe I've been in the bed too long. Maybe I need to get up and, get on my birth ball, or maybe I go sit on the toilet, or maybe I should go walk a hall, or maybe I should go, do some tug of war or anything else. So movement is huge in birth. We know that. What does your intuition say? The moment that you see a positive sign on a pregnancy test, something changes in your heart. You are a mom. You are a parent, and that's whether the baby comes earthside or not. You are a parent. So what does your gut say as a mom? Or, if your partner is there, as a dad, like what is it that as parents, what does it say? Just because the doctor is telling you something, if it doesn't sit right on the inside, then God gave us that for a reason. It's like a little GPS for us or whatever, telling us like something's a little off. So that's your I. And then in, what if we do nothing at all?
Yeah.
So what if you just give my body an hour or two and you come back and talk to me then, and we can go back to, is this an emergency? What's the benefit? What's the risk? What's the alternative? What's my intuition say? And what if we wait another couple more hours and figure this out all over again? Because you cannot rush birth. You can't rush it. And a lot of times when it's rushed, then that's where we see some of that trauma everywhere, from the verbal abuse and the dismissive attitude and the manipulation, all the way down to somebody shoving their hands up in you to check you without consent. And then further on down to some sort of vacuum or forceps extraction. And then you end up on an operating table with the unnecessary C-section because, questions are not asked. And we just believe that these doctors know everything. And while they know a lot, they don't know it all.
They don't. And so, okay, so I don't even know where to jump in, because with y'all, it's like double dutch. It's like a fast game of double dutch, man. Okay, so one of the things that really highlighted for me what you said a rush birth leads to trauma. Like just recognize it. And I don't feel like we understand culturally, you know what I mean? Like on the big scale, you know what I mean? Culturally on a big scale, that birth is supposed to be slow moving. I recently had a first time mom give birth, and and I told her, and I was like, hey, as a first time mom, sweetheart, you should be prepping mentally that this is going to take about 36 hours. Baby girl's birth within like 16 hours, right? But I was talking, I was like, about 36 hours is on average for a first time mom. But you gotta really understand what 36 hours looks like. 36 hours doesn't look like 36 hours of pushing, you know what I mean? 36 hours looks like slow moving. Like 36 hours looks like Netflix and, you know, and chips on the couch. You know what I mean? 36 hours looks like a bath and a back rub. 36 hours. There's so much that you can do in 36 hours that is not done and cannot be done in the hospital, right? Because 36 hours, look, 36, if you go to the hospital on first contraction, 36 hours is going to look like tied up to somebody's machine and somebody coming back and checking your blood pressure every 30 minutes. You know what I mean? Like, it's going to look like somebody trying to stick their hand up where it doesn't belong and stuff like that. That's what 36 hours is going to look like in a hospital. But when you recognize that this is the first time, and this, I'm speaking specifically to first time moms, when you recognize this is the first time that your body is opening like this, like, and I'm gonna do a little biology class, because we have the vagina, we have the vaginal opening, and then inside we have the cervical opening. And so the cervix has never opened like this. So, so you could say, hey, well, you know, like, I've done a lot of things in my day. Okay. Yes, ma'am. I'm sure you have. And at the same time, your cervix has never opened like this.
Okay.
And so it's important to leave room for your body to process that. And it does not, I'm telling you, like, the uterus is an amazing organ, and it is absolutely, like, it's absolutely giving your body everything it needs so that it can open, and that every time you move a centimeter, it's not excruciatingly painful. You know what I mean? Like, your body has a way of not just relaxing, but feeding that, you know, like, what's the word? It's, what's the hormone that it's
Oxytocin?
No, it's another one, but it blocks pain. It's a specific specific one that blocks pain. Look, you know me and notes. Woo. Okay.
Well, you mean when they start to have when your body's starting to open up?
Yes.
It is on the tip of my tongue.
Yes.
We'll send it out on the
there's
replay.
A specific
replay notes.
Yes.
So there's you're starting to, like,
hormone.
Zone out. You literally, like, start to, like, your body, you start to zone out. And so it almost becomes like an anesthetic.
Yeah. Yeah, absolutely. Yeah. So, okay. So you and I are talking about the same thing, and I can't think of the word, but there's a specific hormone that our body releases that essentially numbs the body. It's similar to, I can't even think about it. So there's a specific hormone, but you would never know that talking to a doctor. Like, no doctor is going to sit there and be like, oh, you know, like, we could give you this epidural, or you can go a little bit further and allow your body to open naturally, you know. Endorphins. So the endorphins, and so there's endorphins. Come on, come through. So there's endorphins, but there's beta endorphins, and so it's like the endorphins, but then it's like the endorphins on steroids. And so like it's really important that we understand our body, and we understand, like, what our body is capable of. But you would never know this talking to someone who feels like they are your savior. But it's important that you understand, no, my body was created for this. It, like, how did we get to 2022 and we've only been birthing in hospitals for the last 100 years? I don't care. Look, history and notes. I got you. So historically, we have only been birthing in hospitals for 100 years. Prior to that, we were birthing at home. Prior to that, we were birthing in community. Prior to that, we were birthing safely. And I don't care how many times they're like, oh, well, people used to die in childbirth. I will tell you what, the reason why people used to die in childbirth, I guarantee you when you find the records of when we used to die a lot in childbirth, it's when, I don't want to say it like that, but I'm going to say it like that. It's when men got into the birth room. When they got into the birth room and they started putting their dirty hands where it didn't belong, and they were passing along germs. That's when women started dying during childbirth. Before that, we were doing our own thing. We were pushing out babies, and wasn't nobody the wiser, because, like, before 100 years, there were no OBs. There were no male doctors, especially not concerning women. They did not focus on our bodies. It was not until, I won't go there. I won't go
No,
there.
go there
And we,
because
and,
no,
and we have more
quickly, go
people
there.
dying in birth now
And we have more
Yeah.
people dying in birth
And we
than
have
we
more
did
people
then.
dying
and
now.
as
So,
a
2023.
as a global, you know what
right.
I mean, like, and as a world leader, we still have a lot of people dying in birth. And I'm not going to say everybody who goes into the hospital is going to die. That's not my case. What my case is, that you as an individual, your body is designed to birth naturally.
Amen.
And regardless of what they say, you're capable of it. Barring any emergencies, your body is capable
Mhm.
of birthing. You just have to understand how to work with it. It's like if you had a car, but you didn't have the manual. You had a car, you had no keys. You don't know how to work with it. The more you know about your body, look, I could pump childbirth education all day long because it's so, so important. But the more you understand about your body, the more you can prevent the trauma from occurring, and like the more you can prevent the trauma from occurring, and then recognizing that your trauma, like as mom's trauma will become dad's trauma, and if they have a doula, it may become that doula's trauma. If the doula is positioning herself well in the room, there is a lot that we can buffer. There is a lot that we can make room for. So, like last time we were on, I asked you, look, I will just ask the question. Like, you don't have to like me when we go home, but I will ask the question if it means that my client gets a say in her care, right? And so I'm going to speak of my own situation where I walked out of the birth room with a traumatic birth experience, and mom and dad were none the wiser. So I had a client 2 years ago, beginning of 2020, right before the pandemic hit. It was like early February, February 11th specifically. So early February, I go into, so my client goes in for an induction. And they had hired me on a reference and stuff like that. And I really valued the referring client and stuff like that. And so I was like, I'm definitely going to take this client. It's late in the pregnancy. I don't have a lot of experience with this person, but I'm going to give them my best week. I have maybe like 2 weeks with them, 2-3 weeks with them. And so we get into the induction process, and I'm feeding them information. Prior to this, we were sitting down in a one-on-one, and I'm explaining to her, hey, if this happens, then you know this. If this happens, then you know this. Like, if they say this, then you say this. If, you know, like, and I'm giving her the back and forth. And she looks at me very sweetly, and she says, you sound a bit like a conspiracy theorist. And I was like, okay. Like, okay, you know, like, I understand. Because this is
the whole system is a conspiracy to do what they want in your body.
So I'm like, okay, so I understand that you're not ready for all the information that I can give you, and so I will give you it bit by bit. And so she goes in for the induction, and I'm like Johnny on the spot, you know what I mean? Like, I want to be there. I'm like, just let me in, you know. I'm like, let me in, you know. And so I'm like, hey, can I come? And she's like, no, not right now. And I'm like, hey, can I come? No, not right now. And so by 6 p.m., so she goes in at like early in the morning, maybe 8 a.m. I wanted to come at lunchtime. She was like, no. I wanted to come at 6 p.m. She was like, no. So about 8 p.m., at this point, I'm like, I'm just walking in on you. Like, I'm just walking in on you. You can't be my client, and I don't know what's going on with you and stuff like that. And so I'm driving there, and, you know, I let them know that I'm on my way. And so the husband comes, and the husband says, she's only at 4 centimeters. We don't think it's a good time for you to come. And I was like, I understand that. And then she has a contraction, and she is howling at the moon. Like, she's going for it. You know what I mean? Like, climbing the walls, going for it. And I'm like, what's going on? And and the husband says, well, they did this procedure, this procedure, this procedure, and now this is where she's at. And I'm like, why did you do any of those? Those were all the things I said don't do. And they were like, well, that's what the doctor suggested. And our doctor is a really good doctor, and we trust him. Okay. So now So you trust them, I have to trust them. Okay, so let's go for it. So baby isn't born until the next day. I walk into, like, finally they're like, hey, can you come? I get there around 3 p.m. the next day. She's already have the epidurals and stuff like that. And so I get there, and as soon as I walk in, she's like, Jen, I need a bucket. I give her a bucket. She throws up. I was like, that sounds like transition, sweetheart. We're close. And so doctor checks, and no, the nurse checks, and she's like, oh, you're 9 centimeters. Let's start laboring down, right? Labors down, and like but she still has great mobility in her legs. So I'm like changing positions. We got her on hands and knees. We're doing all the things. Doctor comes in and says, okay, well, we got a couple pushes, and then we're going to see what we have to do next. Pushes a couple times, and she's like, oh yeah, I could see the baby. The baby's very close, but it doesn't seem like you're in a good position. Let's lay you flat on your back. That doesn't sound like a good idea at all. So she lays down flat on her back, and they push the bed up. So her neck is kinked, and so she can't breathe. And so now her, like the baby's heart rate is dropping, her oxygen levels are dropping, and everything is out of whack. And I'm like, hey, can we get her up on her hands and knees? And the doctor looks at me and says, I won't be able to use the vacuum in that position. Okay, but if she was on her hands and knees, she wouldn't need you to use it. But that's neither here nor there. Okay, so then like she pushes one more time, and the doctor was like, you know what? It doesn't look like this is gonna work this way. Nurse, can you suit me up? So I'm standing in the birth room. Baby's head is right there, like getting ready to come out. Doctor has given up on the option, and now they're suiting up, mask and everything. Mask. They got the little blue boots on and stuff like that. And I get real close to my client, and I was like, hey, sweetheart, baby's coming one way or the other. Let's do it your way. You got one good push left. And she pushes that doggone baby out. But here's the problem. That doctor was going to do surgery on a mom who did not need it. And this is the problem. This is the problem, right? Because we're having surgeries unnecessarily. You know what I mean? Like we're keeping mom in positions unnecessarily because I can't use a vacuum. You can't get out of that position because this is what's convenient, like, and then like before I left, doulas do the 2 hours after birth and stuff like that. Make sure mom has everything they need. Make sure blah, 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 blah is happening. The doctor comes and goes and stuff like that. And I am very admonishing. I like to love on my clients and stuff like that. Like I tell all my clients, look, I'm gonna hug your face, like your whole face. I'm just gonna hug it because I just want you to know that I value you, and I love, I love the strength that you're bringing to the table right now. And so, like I'm admonishing her before I walk out the door. Hey, you did a great job. I'm really proud of you. This is a good thing. And she says, you know what? I'm just not good at this. And I was like, what? You're just not good at it. How could you just not be good at something you're designed to do? You're built to do it. But her situation, she was 37. And so she was considered geriatric. And they processed her like she was a high risk the entire time. And so she's had months of them filling her, and she had 2 weeks with me. So I could be your hype man all day long, but you only got 2 weeks and you have 40 weeks with them. You know what I mean? Like that's a whole lot that I have to come back. I walked out of that hospital and I just cried in the car because I was like, yo, I've never been that close to a client getting cut. You know what I mean? Like I've never been that close. You know what I mean? Like it was literally like, let's get it done. You know what I mean? And I was like, how crazy that I was the only one in that situation that realized that there was a problem. You know what I mean? Like that realized that her body was capable, and like from the outside coming in, like it might be like, oh, well, that's not that traumatic, like, that didn't really warrant tears. Look, I'm not a crier. Like it was definitely a traumatic situation. And so like, and that family was none the wiser. They walked away not feeling like they could birth, feeling like their doctors gave it them all. And I walked away knowing that that was not a good experience. And now I tell clients, don't go to that hospital. And when clients decide to birth at that hospital anyway, I'm like, okay, because that person's situation may not be yours, but I also know like the quality that hospital produces. And so it's very like, I won't say listen only to your doula, but I will say keep your doula's words in mind. That's what I definitely will say, because your doula, like, they do it for a reason. All
And
right,
there lies
Jen,
conflict.
you said conflict,
I was gonna say, and therein lies the conflict.
and therein lies the conflict.
You know, and so that's why the doctor made the comment, doulas just cause conflict. Doulas don't cause conflict. Doulas
Right.
just make it easy for them to do what they want to do.
Yep.
Right.
A couple of things you said, Jen, because I know we're closing, but to wrap up and make sure people have the good information to take back with them. When you were talking about like birth has only been in the hospital for like the past 100 years, because historically birth has been supported by a village of women.
Yeah.
And I say that to say now it's like birth has been this huge support thing. Everyone's around, they're there, they're supporting. But now it's like, no, we don't need you in the birth room. No, you can't come in. You can only have one support person. You can only have two support people. When we know, and research is shown, because they love research, and that is evidence-based practice. Let me say this about research and evidence-based practice. Those things are only in line so that people can do the things that they want to do as well. But let's just move forward. I did research for years and years and years. And so even with research and evidence-based practice, it shows that people who have continuous labor support while they are while they're laboring do better. They have better outcomes. They have less pain.
Right.
They have less interventions. They have less incidents of inductions or C-sections. We know that, but yet we're still separating people who are pregnant and that are giving birth from having support. So that's crazy. And also earlier you were talking about the first time mom. Your body is new. It's new to this thing called opening up. It's new to everything is new. So if you know this and your body's never done this before, then why are we in a rush? Why is there a time limit on things? Why am I
Right.
telling you that your body's just not progressing, or you just can't do it, or this is just not going to work? Why am I telling you this? You've never done it before. Your body's never done it before. So it's like it's something you got to get used to. Like if I walk into, I don't know, let's say swimming. Just say you've never been swimming before. You got to get used to it. You got to learn how to swim, right? You got to get in there. You got to figure it out. It's almost the same, and it's almost like they don't. I'm not gonna say it's almost like they don't. They don't give your body a chance. And let me say this about your body, guys. The hospital alone, there's a white wall psychology that talks about how your mind starts to shift and change as soon as you walk into the hospital. As soon as you walk into those four walls, those four white walls. So if you are afraid, your body is automatically in a state of arrest. And the more afraid you get, the more anxious you get, your body can shut down and your labor can halt. Yeah. So it can slow. And it's not that there's something wrong with you. It's not that you're not made for it. It's not there's something wrong with your body or your baby. You're just in an environment that's not conducive to labor.
Yeah.
That's not therapeutic, and it just doesn't make you feel safe. So the two things that I will tell you that I want you to know, because people just don't get it, not just pregnant people, just my patients on a day-to-day basis don't understand two things. One, you have patient rights.
Yes.
You have rights as a patient.
Right.
And two, you can refuse anything. You can say no to anything. It does not matter what it is. And if it's truly an emergency, they're not sitting there talking to you about it for 30 minutes. If it's truly an emergency. And so just understanding that we just want you to be informed so that you can make the best decisions for you. Because people are not, they're not only are you misinformed, you're ill-informed. So you're giving the wrong information, and you're not giving enough information to make the decisions that you need to make. And like Nicole was talking about earlier, using your brain, the acronym over and over and over and over again, and ask every question. And if it doesn't feel good, don't do it because the doctor says to do it. You know what I mean? So you don't do it for that. Doctors will say anything. I had a client in transition vomiting. I'm pumped. I'm like, yes, because I already know where we're going.
Yeah.
She was, before that happened, they had checked her and she was 7 centimeters. I'm like, yeah, we're clearly like, we're passing the 8. We're smooth sailing right now, right? She keeps feeling like she's having to poop. Okay. Oh, we're game. Shift change comes in. We got a whole new crew. I could tell this new crew was just like not having it. The nurse comes in, automatically sets up the table, pulls out stuff for the doctor. I said, what's that? She was like, well, we're not sure that she's progressing. I was like, she's definitely progressing. She's already vomited. She keeps feeling like she has to poop. We're back and forth to the bathroom. She's doing amazing. They come in. I was like, we're going to get them to check her again. It was a midwife. The new midwife comes on and she's like, oh, yes, she's only 5 centimeters. Okay, she's not 5 centimeters, but I know you guys are going to tell her that. She's like, yeah, you're just not progressing well. We just got to go ahead and give you an epidural and get you set up. And she was just looking at me like, I don't really, she was like, yeah, because you got to be tired. I know you can't push anymore. You've been pushing all day. Yeah, we're really just going to help you out. They really make it feel like it's something they're doing for you. But understand, honey, it is for them. I'm going to tell you who's there in your corner, your doula, and whoever your partner and your support person is. And so
It
just
is.
understand, this is why we want you to be informed. It's not to say, oh, the hospital is trash. Oh, the doctors are trash. Some of them are. But that's just, we can't handle that. We can't necessarily change that. But what we can do is inform you, give you information, tools, and resources to help you make the best decision for you. And that's what we want you to get.
I think it's about being able to identify it. You know what I
Yeah.
mean? Like, and I'm reading through like some of the comments and stuff like that, and I really appreciate Tiara being on. She says, I pray the gap is bridged between doctors and doulas. I believe we truly can change the world if those two can come together. And that,
Yeah.
like, I don't think you're far off in that thinking and stuff like that. And so I never want to posture myself against doctors. And at the same time, as a doula, I do not work for doctors. I work for my client. And so like it's, and oh man, can I be weird? I'm gonna get a little bit biblical for y'all. So check this out. So it says, there's a scripture and it says, like, you can't serve two masters. That's the bottom line. You can't serve two masters. And so as the client, like, you really do have to be able to balance both what the doctor says and what the doula says, right? Because what the doctor is saying is based off of their education and the standard operating procedures, right?
Right.
Their education and their standard operating procedures.
So what's education, Jen? Where did they get the education from, right?
From a schoolhouse, right? From a schoolhouse, from some
someone
textbook.
told them, who
Exactly.
told them, who told them.
And what the doula's experience is from watching them. And so you really have to balance, like, oh, okay, so this is textbook, and they've seen a lot of births and stuff like that, and they've processed a lot of births. And then you have a doula who is watching them while they're processing births. And then, and I'm not saying one is greater than the other and stuff like that, but both are valuable if what we are trying to prevent is trauma. If what we're trying to prevent is trauma, then we have to take both sides of it and go through the benefits, the risks, the alternatives, the intuition, what if we do nothing? And lastly, I'm gonna put an S on this. Does this feel safe? Do I feel safe? Because ultimately, if mom does not feel safe, if dad does not feel safe, we're already slipping into that slippery slope of trauma. If it doesn't feel safe, it's no longer good, and we have to take a step back. It's right. Not the time to ramp up and just start doing things until we feel safe. We have to and again, barring an emergency. In case of an emergency, we go with what doctor says because it is an emergency, but you have to be able to identify what is an emergency and what is not. Just because, like, if everything is fine, then everything is fine. You know what I mean? Like we've given examples in different situations, like nothing is wrong. You know what I mean? Like right. Just because you're 40 weeks in one day doesn't mean you need an induction. Just because, you're a first time mom and you're failing to progress after 5 hours of labor doesn't mean you need a C-section. You know what I mean? Like, you have to be able to identify this. Just because, I'm gonna touch on something. Just because, look, I don't even want my face to be sewn. Just because you have twins doesn't mean you need a C-section.
Come on,
like,
okay.
and
that's talked to someone yesterday about that.
That's not even being
just
triggered.
Because your baby's breech doesn't mean you need a C-section.
That's my next one. Because it's like, oh, I have twins, I have to have a C-section. Like I have a good friend of mine who had a C-section, and now she can't get off the pattern. You know what I mean? Like, now she can't get off the pattern because she had that one C-section because she had twins. And she's like, had I known these kids could come out, I would have let them come out. You know what I mean? But if you don't know and you can't identify it, then we just do it. And at the same time, some twins need a C-section. Like I had 2 sets of twins last year that had to come via C-section. And barring an emergency, like, we can still birth babies naturally. Like, one set of twins, look, forehead to forehead, They were they refused to put any pressure on that cervix, and they refused to let anyone else out. They were forehead to forehead. We can't do anything about that. We have to have surgery. You know what I mean? Like, you know, like, and so like I understand like sometimes like as a doula, we may sound emotionally driven by our passions, and at the same time, statistically, what's going on in hospitals is not because mom is well informed and this is the way her body operates. It's usually because mom is ill informed and she has no idea what else she could possibly do besides get that epidural, besides take that C-section. Without a playbook, without a playbook, you're going to go by their playbook every single time. And so it's important for us to have tools. And I'm not saying you kick against the gold all the time and stuff like that. You just tell your doctor they don't know what they're talking about and stuff like that. No, I'm a firm believer. Look, every time I come, look, mask and all, I always got a big cheesy grin because I need to be able to work well with doctors and nurses. I want to be able to work well with doctors and nurses. And at the same time, I am invested in my client's outcome, as close to her birth plan as we could possibly get. And at the same time, I'm also educating my client so that if we slide away from the birth plan just a bit, that she can posture herself powerfully so that it's not a traumatic experience. Like, ultimately, like, we're here not just to make your birth plan come to life, but to like protect you from trauma, like, but to protect like what you are bringing into this world and stuff like that. So come on, Nicole.
Yeah.
What you got?
I've been biting my tongue. I think, okay, first going back to what Ebony said about like, doctors and the things that they're saying and everything else, like mindset. I think a big thing is on the other side of that is like the positive mindset. And I think that's one of the things, you know, we work with when we're working on preparation and all that other stuff is your mindset so that you're prepared for birth, so that whatever it is that you're encountering on the opposite side, regardless of what it is, you're ready for it. So mindset is everything in birth. So to me, mindset and your body sort of go like hand in hand. You can't do one without the other when it comes to birthing. And then, you made a comment, Jen, about like us being like emotionally driven, but I think you said like, we're not these emotionally driven doulas. No, we are emotionally driven doulas. This is a passion. No one falls into birth work because they just wanted to, you know, well, let me just watch a baby be born. No, it's a passion. And it's something that at least I know on my end, I'm sure for y'all too, like you're almost born with this innate sense of something that is extra that has to do with birth. You're not birth and really not sure like how or what draws you to it. But there's nobody that needs to sit me down to tell me to read a book on birth or to learn more or to follow the history. It's something I voluntarily do because it's a passion. And that passion and that emotionally driven side of us that we then match with the knowledge that we have is what makes us a doula in the first place. That's what we bring into the birth room. That's what we come into and hold your hand as you're pushing out this baby. That's what we're doing when we're whispering in your ear, like, you've got this. This is yours. You're doing it. While somebody may or may not be standing on the side, not believing in your ability to do what your body was made to do. So I think, you know, when you say, oh, we're not emotionally driven now, I'm emotionally driven. So there's definitely a passion and emotion behind it because you know, we don't take it on because we don't believe in you. We definitely do believe in you. There was something else. I don't remember what it was. I think, you know, just going through like thinking about like the trauma and the births and all of that stuff, everything from like my own birth trauma to my very first client, August 27th, 2004, saw my first episiotomy. Like I remember that very clearly. And it was not a consented episiotomy. Mom did not know that she even received episiotomy. And the doctor moved so swiftly that no one in the room could have said, I mean, I never seen any scissors just fly out of anywhere that quick. And, you know, she didn't have birth trauma from it because she has a lot going on down there. So she didn't feel it. I had trauma from it because I saw it with my own eyes and saw the way it happened. And I know, that it wasn't a consented act against her. So I think, and thinking about just not birth trauma for the person laboring, but the birth trauma for other people in the room. Like I said, it's not even just the doulas, but it's also the partners. It's also the nurses. And sometimes, I will even say like the doctors and the midwives and things, they experience it, not so much from the point of the things that they may be providing, but from the sense of like stillbirth, or, they see it in shoulder dystocia, or if something like, when they are believing in their client and they're having to rush into something, or, something traumatic happens for them as well. So there's definitely trauma in the birth room, across the board. And I think, Jen, you said something about, like us not necessarily being against, doctors and medical and everything else. If anybody has followed me for any amount of time or looked back at my stuff, back in December, I had a client birth in the car. And in that moment, I realized, like, no, I love doctors and midwives because I don't want to deliver a baby. I am a doula and I support you emotionally and educationally. I do not want to deliver a baby, not at this point in my life. So I think, there is some, although we have seen a lot of bad, medical providers out there, we also see a lot of great ones. And so I think you both said like not creating a sense of fear when it comes to the hospital or comes to birthing, because they're great providers. The big thing is finding the provider that is going to be great for you, and that actually believes that you can do what you're going to do. And if you learn for some reason that that provider is not for you, regardless of whether you're at, 10 weeks, 20 weeks, or you're right there at 38 weeks, do not let that provider touch you. Find somebody else or walk into a hospital without a provider at all, because you're still going to have a baby. People used to have babies in fields, so it didn't matter where you're going to push this baby out at, the baby's coming. But make sure that whoever's by your side is actually by your side and not there for their own agenda and everything else. And so, and I know, like you said, we're about to wrap all of this up. I would just say on all sides, whether you're the birthing person or whether you're the person that's in the room, if you have experienced any kind of trauma, make sure that you get help on the other side. Make sure that you're surrounding yourself with people that you can talk to about it, that actually listen to you. If that means counseling, or that means, in our situations, a lot of times we debrief with each other, other birth workers, other moms. There's support groups out there for birth trauma. Make sure that you deserve to be safe. You deserve to feel good about yourself, about your birth, and about your baby. And a lot of times as moms, we tend to, after we have a baby, run out and try to still do all the things that we did before, making sure you sit still and take care of yourself. The United States is the only country that does not believe in true postpartum time. Take the time, sit on your butt. You cannot pour from an empty cup. It's impossible. So you have to take care of yourself in order to take care of somebody else. And so I think that's it for me. So
Look, you said a mouthful. You said a mouthful. Look,
I'm biting my tongue over here. I'm like,
look, so we're gonna have to get cards, like cue cards, like just raise your hand and stuff like that.
a flag.
So yes, like a small little flag. Like I got next. Man, so okay, so one thing I want to say, if you are experiencing any kind of trauma, there is any kind of trauma in your postpartum time, there is a national hotline for postpartum. It's Postpartum Support International. It's PSI. Quick Google will bring up the number for that. I'm going to leave that in the notes. I think it's really important that we not just brush past birth as if it's just one day, like when we're working with clients, we're not just focused on that one day. We want to make sure that PSI International, thank you. We want to make sure that you're able to sustain not just your life, but that baby's life into your postpartum and onward. And so it's not just one day that we're preparing for. This is a lifetime of experience. And we want to make sure that it starts out on the right foot. Always, we want to make sure that it starts out on the right foot. And so this is why we provide the support that we do to our community and to our clients. So if Like if you're feeling down on anything that you experience, PSI would be a great resource for postpartum depression, for any kind of PTSD. Speaking with your doulas. As doulas, we always do, or we always should do a debrief from birth. Like, how was your experience? What are your feelings? What are the emotions that came up? The more you know, the better these conversations go. You know what I mean? Like, because you'll be able to identify, oh, you said this and this happened, and you said that and that happened. And that is really helpful for mom to feel like she has control. We want to stay away from those feelings of helplessness and hopelessness and out of control, so that mom can go into her postpartum time feeling powerful and feeling like she's able to, take care of this new life. Life with the mix. I'm reading all your comments, and I'm chuckling over here, you guys. So thank y'all for joining. Ed, do you have anything? Oh, before we go, listen, my name is Jen. I am a doula in the DMV area, in the DC, Virginia Metro, Maryland area. I work with women during their birthing, postpartum time. I do education and all the nine. Ebony is out in sunny California. So if you are looking for a doula and you are in that area, my good friend Nicole is down in the South Carolina, North
Charlotte.
Carolina. What's that? Is that Charlotte? Is that Charlotte?
Charlotte.
It's the border.
Charlotte.
Yes.
Charlotte area.
Charlotte area, and she's absolutely amazing. So if y'all need a doula, if you guys are looking for a consult, please feel free to reach out to us. Any last words? Any last words, ladies?
I think I would just like to say that birth is amazing because it's creation. And I feel like that is what the system sees. And they see, if I can start here, changing, manipulating, structuring, that is why there's so much emphasis on pregnancy. Pregnancy is a diagnosis. That's why there's so much emphasis on controlling the birth room, controlling who's there, controlling the outcomes. So just understanding, like, it's just power in walking around with the uterus, but
so much power.
Hold on to the power, hold on to the control. Don't let anyone take it away from you, because creation, beginning of life, is where it all starts. That's where you literally have a chance to change your life, the life of your baby, the generations to come. Like, it's major. It's more than just the doctor trying to perform a cesarean or an induction or all those things, because all those things, those outcomes, they're going to affect that your birth, yourself, your baby, your family, for years and generations to come. So it's huge. It's not just about the one little things, it's all the things collectively. And like Jen said earlier, like, it's beyond understanding. Like, I'm and just real quickly, like, Ed, like, I'm in LA, but I'm huge on wellness. I'm a fertility, birth, and wellness doula. I'm huge on wellness because I feel like wellness is the actual link to all healing, life, and thriving. So I'm huge on, like, mind, body, spirit, physical, emotional, just making sure that all those things are in harmony and they're in balance. And just, unfortunately, that just goes against what we're told in Western society. Absolutely. So just understanding that you have the power, go within, use the resources as you need them, but understanding, like, you have everything you need to have a beautiful, amazing pregnancy journey, birth journey, and all in between and beyond. So that's what I want you guys to just feel and know, that we're here. You're our priority, and we want to make sure that you feel safe, that you feel heard, that you feel seen, and that you feel supported in your spaces. So thank you guys for tuning in.
Nicole, you got anything for us?
I'm trying to think. I feel like y'all have covered most of it. I think the only other thing that I would probably add is that if for some reason you have experienced birth trauma, or even if you're a doula or a birth worker that has experienced trauma and you're having issues finding support, we're here as resources. So you can always jump into any of our DMs. And I saw somebody was looking for a doula, I think in the New York area, same thing. If you want to reach out, we have the resources to, find other support in other areas as well. So just knowing that, we're here and we do support, and we all also offer virtual doula support. So even outside of our individual areas, we can support you virtually if you can't find somebody that could be by your side, and or your hospital is not letting doulas in at the moment. So
and don't sleep on
just
virtual
making sure.
services. Don't
Yeah.
sleep on virtual services,
No,
because
no, no.
Please
we
don't.
can doula a
Yeah.
situation. Look,
Yeah.
okay,
Yeah,
so
but so we're all resources. So tap into your resources. Follow all of us. We all sort of fall into different lanes. Some of those cross each other, some of them not. But check in, and we do check our DMs on a regular. So we'll get back to you. It's nothing that we just say and don't follow through on. So.
okay, so as we close up, I want to reiterate what Nicole just said. Follow us, because next week we will be coming live on. Are we coming live on Tuesday, ladies? It's National Doula
Yeah.
Day.
Doula Day.
Mhm.
The
World
22nd.
Doula Day.
Is it the 22nd? Yeah, it's 22nd. I think that's Tuesday.
Yeah.
So we'll be coming live next Tuesday. We will be on Nicole's channel. So if you follow her directly, you'll know when she goes live. You should know when we go live too, but just in case, follow all of us, and you'll see us next week. We are discussing why I became a doula, and then the week after that we'll be on with Ebony, which I think is a really great conversation. We're going to be talking about Black women birthing with MS. Look, it's a whole conversation. Tell somebody about it. MS, from Ebony's conversation, she says that like a lot of times we don't even know.
Yeah. Our guest speaker, she actually has multiple sclerosis, and she actually had a baby. And just talking through her experience with that, not even, because of course we're underdiagnosed, Black women, all the time for everything. So not even knowing what that feels like, what it looks like in the birthing space, and also understanding that your doctors or nurses, they have no clue. They have no clue, not a clue on what's going on and what's happening and how to even treat and support that. So imagine all of the things
All of the
have
things.
MS on
Yes.
that. So that's
the
gonna be
next
amazing.
2 weeks will be live. Thank y'all so much for showing up. It's always a joy to be in the room with y'all. I hope to see y'all next week.
Thank you. And one more thing.
Go.
Next time we post for Dinner with the Doulas, we'll make sure to put the reminder bell on so you guys can just hit that reminder so that you'll have it.
Yes.
There you go.
Excellent. That's a
All
great
right.
idea. All right,
You guys
y'all.
have a great night.
Y'all have a great night.
Thank y'all.
Good night.